All right. So, Erin D and I will be presenting on the Coronavirus Aid, Relief, and Economic Security, or the CARES Act. And we'll be discussing how the current pandemic affects or has impacted migration and U.S. policy. Next slide. So, some background information. I'm going to briefly discuss the Spanish flu, which was a global pandemic, one of the more modern global pandemics that occurred between 1918 to 1920. It infected nearly a quarter of the global population at the time, so roughly 500 million people were infected with the Spanish flu. And the US government's response was to close public institutions and to ask individuals to quarantine themselves, wear masks, and avoid crowds. So much of what we see today with coronavirus. The government focus was on containment rather than prevention, and there was really a lack of federal government aid at the time. So the emphasis of containment was put on the states and the individual to really take care of it. And the states proved that they were ill-equipped to handle the pandemic on their own, and so it really did spread. And just to give a visualization of past pandemics and deaths, so if you scroll down, you can see that the Spanish flu killed roughly 40 to 50 million individuals that it had infected. And if you keep scrolling, you can see at the very bottom the coronavirus. And it was officially declared a pandemic on March 11th. And roughly, as of April 7th, roughly 78,000 people had died as a result of coronavirus. And then moving on, I just wanted to briefly discuss the New Deal, which was a series of projects and programs that the federal government had implemented in response to the stock market crash of 1929. So FDR, who was president at the time, really focused on 3 R's: relief for the unemployed and poor, recovery of the economy, and reform of the financial system that had led to the Great Depression. And one of the programs he had implemented was the Civilian Conservation Corps, or the CCC, which really focused on creating jobs for unemployed and built infrastructure. So again, going back to providing relief for unemployed and recovery of the economy. FDR also implemented what was called a wealth tax cut. It was an income tax of 79% for individuals who are making over 5 million. So again, going back to that reform of the financial system. And the reason why we included the New Deal is because it changed public opinion on what the role of the federal government should be in our individual lives. So it was the shift of perspective of the federal government has a role in our individual well-being and our individual financial health, rather than just being on national policy.
So as we move into the CARES Act, the Corona virus aid relief economics. Sorry, give me one second. Okay, so I'm going to present on the CARES Act of 2020. So the CARES Act is actually a $2 trillion stimulus package, which is considered to be the third wave of relief for the economy in fighting the coronavirus. It was signed into legislation on March 27, 2020 by President Donald Trump in response to the coronavirus outbreak, which is currently affecting over 239,279 people in America and 896,450,000 individuals worldwide. And these numbers are changing every day, actually. The bill was first introduced January 2019 as the Middle Class Health Benefits Tax Repeal Act of 2019, and it focused primarily on removing excise tax, or in other words, an indirect tax charge on high-cost employee-sponsored health care plans. And that was said to be beginning after December 2019. It was then modified to respond to the COVID-19 outbreak, and again signed into law March 27th. The CARES Act has caused significant problems in the lives of everyone impacted with the new regulations in place, policies, new social norms, and everything else associated with the response to the pandemic. Similar to the response to this Spanish flu outbreak, we have now been asked to quarantine ourselves, wear masks, practice social distancing, experience job loss, had travel restrictions, and experience statewide stay-at-home orders. And many other things that's happening to us all that we all can relate to. So the bill provides relief funds for the stabilization of the economy for individuals, businesses, industries, education, state and local government, and allows for the modification of programs and policies such as temporary expansion of unemployment benefits, and it mandates health insurance coverage for COVID-19 testing and vaccinations. So the breakdown of the $2 trillion stimulus package is listed right here. So big corporations are said to believe an estimated $500 billion. Education and other resources are estimated to receive $43.7 billion. Small businesses are said to get $377 billion. There's a $26 billion safety net. State and local governments receive $339.8 billion, and public health receives $153.5 billion towards relief efforts. Individuals are said to get $560 billion in relief stimulus checks. I'm sorry, 300 billion is going to be provided in the form of cash, direct cash payments to individuals, while an estimated 260 billion is said to be provided for unemployment programs and additional cash relief for unemployment benefits. So individuals who are ineligible to receive the stimulus check are defined as non-resident alien individuals, any individual with respect to whom deduction under 151 is allowable to another taxpayer for a tax payable year, beginning in the calendar year in which the individual's taxable year begins, and in a state or trust. The direct cash payments are going to be really beneficial because we are said to be getting up to $1,200 for individuals making under $75,000 per year. And this actually caps out for individuals making over $99,000 per year. We will also be given $500 additional for each child under the age of 17. Also, in regards to unemployment benefits, it has been expanded to include an extra $600 on top of whatever a worker was already going to receive from their state or local government for their unemployment benefits. So this is really beneficial in this time for those of who lost their jobs unexpectedly or anything due to the coronavirus outbreak.
So moving on in the conversation, the purpose of this presentation is to address how the CARES Act is going to impact migrant communities and particularly undocumented workers, and how COVID-19 is affecting those communities, but also how they're strategically left out of the language of the bill. So there are public and personal health impacts of this current crisis on migrant communities, with many immigrant community members not having access to healthcare to begin with. The social landscape prior to coronavirus having, exploded in the United States and becoming as much of a high alert emergency. Prior to that, there were already issues around healthcare access for immigrant communities. And this has to do with the historic association between police, ICE, and that's Immigration's Customs Enforcement, and other institutions, social institutions like hospitals. So there's a deep fear of being detained, deported, and otherwise mistreated. There also have been some mentions in the recent news articles that I've been reading about language barriers and issues around access to healthcare because of language barriers. That's not written in the notes here, but something important to understand about the community. On the next slide, there you'll see that there are several other areas of impact, namely economic impacts for migrant communities where there are undocumented workers who are facing some of the highest rates of unemployment because of their work in food service, hospitality, and other low-wage positions that have been deemed unessential. So there's that aspect of it, of high rates of unemployment, and there's also the aspect of current factory workers, farm workers who are either legally documented and migrants to the United States or undocumented and migrants to the United States, working in high-risk positions still. So working in, on farms, trying to keep food production up, and factories trying to ship out all of the at-home orders that people are placing now that they're staying at home. Additionally, I heard a piece of information that a significant percentage of the medical workforce, healthcare workers, are often second-generation immigrant families, coming from families that have immigrated here. That's an interesting piece. But one of the major things that I've found in this research was around the criminal legal system and detention centers. There have long been calls for detention centers for the conditions, especially around healthcare access and hygiene, basic personal hygiene in detention centers, to be even acknowledged or improved in any way, because it was such a low standard before of healthcare and personal hygiene in detention centers, and now the need is even greater with the spread of COVID-19. So many immigrants' rights groups are calling for the closure of detention centers with even more urgency than they previously were before the outbreak occurred. The organizations, I listed a few on the slide and the following slide after this one. The main one that I wanted to highlight is an organization called Mi Gente. They are a grassroots group of organizers who work in the Southwest, along the southwestern border of the United States. And they have released a lot of information about their demands to prevent the spread of COVID-19 and close detention centers. This graphic that's showing right now is from Puente, Arizona, via Seeding Sovereignty. So those are two other groups that are working on migrant community rights and trying to help individuals who've been left out of this stimulus.
So we wanted to end with some discussion questions. For our first question, we wanted to know what are some strategies social workers can use with technology to continue to bring awareness to the problems facing undocumented immigrants in the U.S. We know that times are changing, and we are all living in very unprecedented times, in times of uncertainty. So it is important for social workers to be able to be flexible in how we advocate for individuals. So that's our first question. For our second question, we wanted to know what are some additional ways that the coronavirus may impact migrant communities. We have listed a few ways before, a few challenges that migrant communities are facing, like in the detention centers and things like that. But what are some ways that you guys have noticed the coronavirus impacts migrant communities in your work? For our third question, how can we better support the migrant communities during this global crisis? Again, we are social workers, and our job is to advocate and serve vulnerable populations. And in this time, migrant communities are extremely vulnerable, and we should be able to be there and be a support. So, in addition, we have references, and if you would like to view them, you can just click on our PowerPoint. Thank you.
Thanks for listening to our PowerPoint, y'all.